Hi. Knee pain is extremely common nowadays. बहुत सारे पेशेंट आजकल नी पेन की वजह से हमारे पास आते हैं, but because there are many misconceptions regarding the knee pain, I'm taking this topic in front of you. Hi, I'm Dr. Sourabh Kulkarni. I'm an orthopedic consultant and robotic joint replacement surgeon practicing as a head of the department and director of orthopedics department of Fortis Hiranandani Hospital, Vashi. The knee pain usually has multiple causes at different age groups. One size does not fit all. So, we will see exactly what age group, what are the causes of knee pain. If we take a younger patients or a children for knee pain, वहाँ पे हमें basically दो causes मिलते हैं जहाँ पे knee pain होता है. The first cause is a growth. There are many children who are facing the growth spurt, and because of that growth spurt they are having significant knee pain. And second most common cause of knee pain in children is a overuse activity. Overuse activity means these children, they are actually playing to the significant level without a proper training. So these patients, these children usually are having vitamin D deficiency and a calcium deficiency because of their lifestyle. Because of this lifestyle, they are not getting good sunlight exposure, their vitamin D levels are significantly less, their bone is not very well developed, and on that they do a competitive kind of sports activities that leads to overuse. So in this patient, what we should do is we should train them properly to play sports. They should have a proper training and pre-sports warming activities. They should have a good controlled sunlight exposure to have a regular vitamin D production inside their body. Now, the second age group which we will be discussing is a young age group, young adult age group. So this is a 20 to around 40 to 50 years of age group. The major cause of knee pain in such patients is a lifestyle disease. So what do you mean by lifestyle disease? These all enthusiastic adults, they have a significantly sedentary lifestyle for first 5 or 6 days of a week, and then they become extremely active and they do overt activities and sports activities on weekends. Maybe another way, there are people who are doing regular exercises in a day, but for 1 hour they will do extreme weight training, and for rest 8 to 10 hours they will be sitting continuously idle. So this mismatch leads to the problem, and this mismatch leads to overload on your knee joint and you may have a pain. Second common cause of knee pain in these patients is obesity. Because of sedentary lifestyle and bad food habits, these people usually have significant obesity, which also contributes to the knee pain. And another cause of knee pain in such patients is a sports activities. So enthusiastically done sports activities leads to sprains and ligament injuries, ACL injury, PCL injury. They are extremely common. They also can get meniscus injuries, which are avoidable by doing a proper training in sports. Now, the third age group, which is a older age group. So, if we consider a age group which is around 50 plus, then major causes of these knee pain are degenerative changes. What are degenerative changes? As the age progresses, the lubrication in the knee joint goes down, the quality of cartilage in the knee goes down, and that leads to problems. So these patients have significant degeneration of their knee joint. The joint space in their knee goes down from 8 to 10 millimeters and gradually to zero level. This is called as a osteoarthritis, and there are 4 grades of this osteoarthritis based on which the treatment options are decided.